Understanding what we mean by mental injury can feel complex because, well, people are complex. So to help shed some light on this area of our cover, we're going to explain our process for covering mental injury and what support is available for our clients with a covered claim. So we know mental injury might seem like an odd term, and in a clinical setting, you'd probably use mental illness, mental health difficulties, mental distress instead. Mental injury is defined in our legislation as a clinically significant behavioural, cognitive or psychological dysfunction. There are several situations where we may be able to provide cover. These include if someone has developed mental difficulties which are caused by a covered physical injury, if they experience a traumatic event at work, or a criminal act like sexual abuse. We can't cover mental health difficulties which are not directly caused by a physical injury or sexual abuse, but there is an exception if a person experiences a single, sudden, traumatic event during their work. If you're a sexual abuse counsellor, a GP or other medical professional who's treating one of our clients, you can lodge a mental injury claim with us. When we receive it, we check whether it meets the criteria for cover. This will usually involve an assessment by a mental health professional or counsellor. This is an important step because it helps us to understand the causal link between the personal injury or event and the person's mental condition. Mental injury can be complicated because often there may be a number of factors which are contributing to a person's mental distress. To decide on cover, we need to be sure the injury event has played a significant part in the mental condition developing. We can't provide cover if the assessment suggests the event has had a minor impact on a person's distress or if it has made a pre-existing condition worse. If the claim is accepted, it means we can tailor the appropriate care and support to meet the client's unique needs. We rely on the assessment report and treatment providers like you to recommend what support your client will need in their recovery. Often this will include one-on-one talk therapy, but there's a range of other supports available, such as body-based therapy, group therapy, rongoa Māori, whānau support and social work support. In some instances, a client may also be eligible for financial support. While waiting for a cover decision, clients may be able to access supports such as counselling or psychological support. Our Find Support website has a list of organisations with therapists available for clients with sensitive claims. And if clients don't qualify for psychological support or counselling through ACC, we can help by liaising with the client's GP to arrange a referral to the right community mental health support. And that's the basics of mental injury cover. Thank you for watching.